Right now. Welcome again to the Achieve Center. I'm Carol Wesley, and joining me is Lou Rossetti. We're getting a little later start because we had technology glitches here, so we apologize for that. We may run 5 minutes a little longer just to apprise you for your schedule. Um, we are continuing our discussion regarding increasing parent confidence in children's vaccinations. This program is funded by a grant from the North Central Wisconsin Area Health Education Center, to whom we're very grateful. Lou, yesterday we discussed some of the anthropology and the sociology of the issue, especially as related to rural Wisconsin. And today, let's continue our discussion by focusing on parent fears and reluctance. Um, in our conversation with parents, oftentimes we hear the horror stories about their own personal experience and family experiences related to vaccinations. From your perspective, what have you heard from parents regarding those concerns?
Yeah, there's a number of reasons over the years, and you're familiar as well as I am, as to why concerns are expressed. Even before I delineate those, let me give you some numbers, Carol, just from
Okay,
the
yeah,
American Academy of Pediatrics. These are the most current numbers we have as it relates to percentage of parents and how they feel about following through with recommendations for vaccines. Now, I'll just give you some percentages. This is hot off the press, so it's current. 33% of parents will tell us that they strongly agree that vaccines are necessary. It's not an issue for them. So a third, yes, I'm on board. I'm a
yeah,
proponent of it. I have no reservations. That's 33%. 26% just go along. They don't raise any objections. Everyone else is doing it. It's the right thing to do. My friends are doing it. My neighbors are doing it. Yeah, I don't have any problems. I'll
okay,
follow through in doing it. Then we have 25% that agree that vaccines are necessary, but they're not as energetic about it. They will follow through, and the wording that was used is they're less sure about their safety, but they won't withhold vaccinating
okay,
their children. That's 25%. Then we have 13% who slightly agree that they're necessary. They're not major gung ho, beating the drum, let's do this
yeah,
type families. They will generally go along with the flow. But then we have 3% that strongly disagree that vaccines are necessary, and they're not going to follow through with it. Now, those numbers have changed. They've almost tripled between 2001 and 2017. And it's interesting to try and consider why we've had a tripling of vaccine hesitant or reluctant or refusal kinds of things. So, as you and I have discussed it, we see an array of concerns that parents express as to why they're not following through with the vaccines. Let me read them.
okay,
We can
yeah, let's
interact
go over those.
and we can interact with them. This is the wording that we hear. This is some of the reluctance we see in the literature as well. You'll hear the objection that vaccines overwhelm the immune system, and parents don't want to put their child through that risk. We've had parents say that natural immunity is what they prefer. They just natural immunity
Yeah.
is better than something artificial.
Mhm.
We've had parents say that vaccines contain unsafe toxins, and so they're concerned about that. We've had parents say that vaccines aren't as effective as better hygiene, just taking better care of yourself. We've had vaccines, or parents say the vaccines aren't worth the risk because they hear some of the data that's out there, or some of the rumors, more
Yes.
importantly, that's out there. We hear parents say, I'm reluctant or I will not give the vaccine because the vaccine itself gives my child the illness that we're trying to prevent. We've had others say, what, the risk of my child being the risk is not worth it. The incidence of the diseases are so low that I don't feel the need to do that. Again, even more recently, we've had parents say, I'm frustrated because the vaccine schedule is so confusing. What do we give? When do we give it? How often do we give it? And there's a lot of misconceptions and confusion out there about that. And this is the one that can be a little bit less hard to put your finger on, just a general distrust parents have expressed a somewhat of a frustration with medical providers. I'm not sure I trust what they're telling me as it relates to vaccines and the effectiveness of it. And then the one that gets the most press is the supposed link between various vaccines and autism.
Right.
That's the one that really catches parents' attention. Although we hear the others, this is the one that seems to be most emotional on
Yes.
their behalf. So those are some of the most common expressions of reluctance to participate that we hear from parents.
Yeah. Yeah, I think parents are really looking for more control related to making medical decisions related to their children.
Yeah,
And I would agree, over the last 25 years, we've even seen a greater push towards that. And having trust in their medical provider as a partner in this, becomes really important. I hear a real concern, and this has been over the last year particularly, related to the number of vaccines the child is given at once.
yeah,
Um, in fact, this morning in a conversation, a mother was saying that she was really upset because she was at her child's year checkup, was told that the child was going to receive 4 vaccinations, which she was shocked by because she had not anticipated that number that day. And I think that there was, I felt from her uh, a frustration, but also a disconnect
yeah, yeah,
with the physician on
yeah,
on that
yeah.
issue. And it, I think that she really was thinking about whether she even wanted to continue with the doctor because of this issue.
Yeah.
And she said, my child had a response. She did not feel well now that day and then the following day. And I'm really wondering about whether that was the right decision that I made in allowing it.
Yeah.
And wow, that's powerful.
That's a powerful thing, and whether that physician did not take the time over the course of well baby care leading up to a year to let mom know this is what our standard practice is at a year, or whether for some reason there was a miscommunication where this mother
Correct.
didn't hear it, the doctor didn't speak it, or a combination of both. I can emote with that mother who walked in thinking this is going to be a simple visit. We're going to walk out with no repercussions. And all of a sudden, oh, wait a minute, you're here for 4 vaccinations, and her daughter's ill the next day or
Yes.
suffering some of the consequences of having all those at once. It's a big deal.
That is a
It's a
big
big
deal,
deal.
especially to new mothers.
Yeah. First time moms, new mothers, or if you got a pile of kids at home and you're taking 2 or 3 of them.
Yes.
I have 5-month-old twin grandsons who received their appropriate vaccination at 5 months of age just this past week.
Okay.
Imagine a young mother taking 2 of them home, feeling the results of being vaccinated on the same day at the same time. And she knew it was coming. So it's problematic for parents. And
It
I
can
think
be.
we, as professionals, and I know the medical community, we have to do a better job at facilitating the kind of communication that whereby nothing comes as a surprise. They
Right.
know what's coming, they can anticipate it, and the best way to deal with some of those fears is to give them information, let them process that information, be available to answer any questions that information brings to them, and not just walk in the door and say, "Oh, by the way, you're due for 4 vaccinations today." That's an unfortunate experience.
And I think in today's world where quote unquote big pharma
Yeah,
is under suspicion
and big pharma dictates.
and big pharma dictates, people, uh, just because of this discussion now, have grown to distrust the vaccinations and
Yeah,
where they're made, and they believe that big pharma is driving the research.
yeah,
So I can hear parents listening to these statistics and saying, I bet big pharma,
yeah,
did all the studies.
yeah,
And that's kind of their mindset. And so they also then say, well, physicians are getting kickbacks.
yeah,
And so I think that um, with the social networking that
Yeah.
occurs, there is so much of a drive of a negative thinking and feeling and belief about the
Hmm.
science, the manufacturer, and then the medical community
Yeah.
as a whole.
I think there's no doubt, Carol, we are in a cultural context in which we are more health conscious from a preventative standpoint than previous generations.
Yes.
Previous generations got an illness and they dealt with it. I don't mean to minimize the illness, but we are so prevention minded today. It relates to our diets, it relates to our lifestyles. We implement all kinds of practices, parents of younger children in particular. The word organic is everywhere.
Yes.
We can buy organic eggs and organic milk and organic butter, and that spills over into so many areas of parenting. We buy the right clothes, we buy the right car seat,
Yeah.
we buy the right infant seat, we
Absolutely.
buy the right food. Nothing wrong with any of that.
Right.
But then when we say that we want to inject your child with something that will prevent a significant disease, some parents could say, you know what, I'm doing organic everything.
Yeah.
And so I think I can, through better hygiene, better lifestyle, better diet, whatever, prevent that disease without the vaccinations. And
Yes.
that spreads amongst young moms. And
Mhm.
it is one of the factors that creates both fear and reluctance to participate.
That's right. And if we go back to yesterday in our discussion about the anthropology and sociology of people's belief systems that they inherited, because just the way it was, is that these diseases are all childhood
Mhm.
diseases and should be expected. All that feeds in together.
Yeah, yeah,
And I think that that really has influenced many people. And that's why we're seeing the expanded number of
I agree.
parents that are
I agree.
questioning. The other thing is the whole Andrew Wakefield issue of um, the MMR uh, causing autism.
Hmm.
That now has really become part of the lexicon within the autism community.
Yeah,
There still are uh, people who are professionals and provide treatment or assessment for autism that still drive that
yeah,
home,
yeah,
that offer alternative treatments for autism. And part of that, once again, has become ingrained in the social network and
yeah,
that community of
yeah,
people whose children have been affected.
yeah. That is one of those. Let me say it differently. Disagree if you choose. Autism has become an industry, and it's
Mhm.
one of those labels that has a stigma attached to it that just gets a response from people in a big way. And is there such a thing as autism? Of course there is. We see the children here. We want to be walking alongside of parents who are dealing with the repercussions of having a child with
Yeah.
autism. But the data just is not there linking vaccinations with
Correct.
autism.
No.
It's
Mhm.
non-existent, and yet all it takes is one person with a bad outcome for whom autism may have been feared as a result of vaccinations. And then that's what gets the press. That's what gets the rumors going,
Yes.
apart from any kind of scientific epidemiologic data.
Yes. People are um, scared. They're almost
Yeah,
hysterical at the thought of the child developing autism. And right now, that is there's such a strong
yeah,
emotional link
yeah, yeah,
and belief
yeah,
system related to vaccines and autism that I think that does continue to drive,
yeah.
these issues related to vaccine
Sure,
hesitancy.
sure. And many parents, Carol, um, again, you've observed it face to face. Many parents of a child with special needs, regardless of what the special need is, wonder to some degree or another, was this my fault?
That's correct.
What did I do during my
Yeah.
pregnancy? What didn't I do? What could I have done early that I should have done differently? And frankly, my experience has been parents want to talk about that. We don't perhaps create a climate in which they feel free to talk about it.
Right.
I think it's wise to ask caregivers, just from a creating a communication standpoint, is there any degree to which you think this is your fault? And let them talk that through.
Yeah.
But a parent of a child with autism is wondering, what did I do here? did I not quit work when I should have? Did I not eat the right things? That little bump I had with the car that jarred my belly, was that reason why my child, you hear all kinds of things. And it's a real fear.
It's a
And
real fear.
and guilt is real for some parents. And in some cases, they're debilitated by it.
And when a parent who is experiencing that guilt and confusion and wondering um, receives information from others whom they sense are believable and they put their trust into it, it just
Oh,
reinforces.
it's devastating for some.
It's just devastating for some. Well, we're going to have to end with our discussion, and we can open it up for questions if anyone has questions that they would like to add or comments that they'd like to make.
I'm not seeing any questions coming in.
We certainly want to be available to you in any way we can. Should you have questions, we're not going anywhere, not today or in the days ahead. Most certainly available to you at any time that we can answer those questions. We do interact with physicians from a wide geographic area. So we think we have a little bit of a handle on how you're dealing with some of these things. And I know as we move ahead, we're going to look at some data that looks at ways in which physicians can facilitate a more open line of communication with caregivers to help deal with some of their frustrations regarding the vaccination.
Well, Lou, this has been an interesting conversation. Thank you. And we'll be back tomorrow for our final segment of this 3-program series. And we're going to be talking about what to do and how to handle in the treatment room when confronted with vaccination hesitation. So we look forward to seeing you tomorrow. And thank you for joining us.
Have a good afternoon.
Yep. Bye-bye.